Hi guys, welcome to my channel. Today I'm going to be talking about dialysis versus transplant. I wanted to talk about these two topics for anybody that is new to dialysis and maybe wants to weigh their options, and also for anybody that is thinking about getting a transplant. But before we continue with this video, guys, I want to quickly introduce myself for anybody that is new here. My name is Cindy Flores, and on my channel I talk about my transplant journey, testimonies, travel, like just anything. So if you are new, consider subscribing. Now let's begin. So the first topic I want to mention is diet. So let's talk a little bit about dialysis. So when you're on dialysis, the diet is a lot different from a transplant. With dialysis, you're on a very kidney restricted diet, meaning low sodium, low fluid, lower high protein depending on your medical exams, low phosphorus, low potassium, etc. and etc. It's super restricted. Like there's certain things you really can't eat because they would just shoot up your phosphorus and so forth. But when you get a transplant, it changes. And it changes a lot because you're not exactly on a kidney restricted diet. You are on basically a transplant diet. And what I call a transplant diet is you can eat whatever you want, except there's like exceptions. So you can't eat any raw food, meaning sushi or ceviche. You can't eat any grapefruit or star fruit. So if you have an obsession with any of those things, then you're definitely going to have to find an alternative, which there is a way around it. I still eat ceviche, and maybe I can make a video about that, how I do that. And then I still eat sushi. I eat the cooked sushi and so forth. So the diet is very different. We have a very restricted diet, low fluid, low sodium, low potassium, low phosphorus diet. And then we have a diet that you have to restrict certain items. Also, another thing with transplant, you have to drink a lot of water. So your fluid intake has to be a lot, a healthy excessive amount, to make sure your kidney and your body is staying well hydrated. Now the next thing I want to talk about is the time. How much time does it take up of your life? With dialysis, you have a couple of options of time that it takes, but it takes majority of your time. Say you do hemodialysis and you're going into the clinic 3 or 4 hours a day, 3 times a week. Then if you're doing peritoneal dialysis, you're doing it every single night from 9 to 12 hours depending on your prescription. So it varies. With a transplant, it's basically part of you. And it takes about 15 minutes of your day, not even that. Most of transplant patients usually take medication, and mostly people take at the AM and then at the PM. So basically every 12 hours. Some people take it differently. But it literally takes you, I want to say you take 5 minutes in the morning to take your pills, and then 5 minutes in the night to take your pills. So it doesn't take too much of your time. In my case, however, I take those 5 or 10 minutes out of my day, and then on top of that, I do a monthly infusion where I go every single month, and it takes around 2 or 3 hours because I live an hour away, and then 1.5 hours, and then the drive back. So that's why I'm estimating around 3.5 hours that I'm there. Not long compared to 3 times a week or maybe even every single night with peritoneal dialysis. Dialysis does consume a lot of your time, and it's a lifestyle, and unfortunately it's a low quality of lifestyle because you're constantly giving your time to that compared to a transplant where it's just a couple minutes of your day and you have a lot more freedom and flexibility with your time. Now let's talk about the surgery part. And I'm talking about the surgery to actually get the transplant, and then the surgeries for the catheters. When I first started hemodialysis, I had the catheter. It's like an emergency catheter, I believe, where you get it on your neck. Later on, after having it for about 2 weeks, they switched me to the permacath, and here's my scar to it. Always reminds me. And I had this for, I want to say like 8 or 7 months. I can't remember exactly. I had it for the remaining period of time on hemodialysis. First, when I talk about this operation that I had up here, the neck catheter, it was not painful compared to this one. So the pain of this one was a lot worse for the permacatheter. It was a lot worse than the neck one. And then after doing hemodialysis for a couple months, I switched over to peritoneal dialysis, which was done in my stomach. The operation for that, I believe, was the most painful operation I've had. It was more painful, in my opinion, than the transplant. They were both painful, but I just feel like the catheter placement was more painful because it was right in the middle of my stomach and it took a lot longer. Like, the transplant was on the bottom part, it was like on the lower half, which was not as painful in my opinion. I just didn't like it. I felt so uncomfortable with it. Also, I don't know if it could have been like a mental thing and half of the tube was sticking out my stomach, so I thought it was more painful. I just find it a lot more painful. However, the healing process is a little bit longer for the transplant because the pain remained there for a longer time and the healing process was a lot longer. For the transplant, I healed over a period of 3 months, and then for the surgery placements with dialysis, I want to say a month for the peritoneal one, and then like 2 weeks for this one, and then like this healed in like 2 days. So if I had to order the pain, I would say the peritoneal catheter, the most painful, then transplant, then the permacath, and then this one, the little neck one. Now let's talk about the limitations. And we're first going to talk about the ones on transplant. With transplant, there's not that many, honestly, guys. In the beginning, yes, there is, because you do have to wait for your body to heal. It takes time. It doesn't happen in a period of a couple of months. Like, it could take up to 6 months. And I know they don't recommend, at least my doctor does not recommend, for you to do any abdominal work until you're about 6 months after transplant, because you can actually hurt your transplant that way. So it does take time, the healing process, but after you're healed, you're basically free to do whatever you want. Obviously, you're not gonna like do excessive heavy lifting and damage your transplant. Like, it's stuff that are reasonable. You're welcome to work out. You can go swimming wherever you want. You can go skydiving. I went skydiving after my transplant. The only limitations that I did mention was basically about the diet. You are limited to certain things. No more grapefruit, like I mentioned before. But there's honestly not that many limitations. Now let's talk about dialysis. With dialysis, the list can go on and on and on about the limitations, but I'm going to talk about a few of them. One of them being with swimming. If you are somebody like a little fish like me, that I love to swim, I love to be out in the outdoors, you might have a hard time because you do have to restrict where you're swimming depending on what catheter you have. For example, if you had a PD catheter, you cannot swim in low chlorinated pools, you cannot swim in rivers, you could only swim basically in a pool that has a lot of chlorine, and then salt water, which is basically the ocean. Other than that, you cannot swim anywhere else. And then with the permacath, you can't even get it wet. So you're limited there. Also, the travel, like for traveling, it's very hard to travel on dialysis. In my opinion, peritoneal dialysis was easier to travel with, and I did do some traveling with it. But with both of them, it's still harder compared to a transplant. I travel easily with the transplant. But with dialysis, you have to, if you're doing PD, you have to bring it with you. And if you're doing hemodialysis, you actually have to set up near a clinic where you're traveling to. So yes, you can do it. It's just a lot more work. Also, your diet is going to be more restricted. Like I mentioned previously, another restriction would be exercise. Like, they do recommend that you walk, that you maybe jog a little, that you continue doing your daily activity to get exercise in, but it's not recommended for you to do heavy lifting. If you have a fistula, you actually are restricted on your weight. Also, if you are doing peritoneal dialysis, I decided to work out, and like the second day of me going to the gym, I actually got an inguinal hernia. And I was not even heavy lifting, I was just doing the most basic workout, and that happened. So you have to be super careful. You don't want to exert your body and damage your body even further. If you do get a hernia while on PD, you actually have to go back on hemodialysis because the operation needs time to heal and so forth. Now let's talk about medications. Let's compare the transplant and the dialysis medications. And for this, I'm going to be talking about my experience, how much medication I was on when I was on dialysis and then after. So when I was on dialysis, the only medication that I took was a blood pressure pill, binders to regulate my phosphorus, and then vitamin D when to leave. So I was taking 3 medications. Now that I'm on my transplant, I can't even count. I'm on a lot. So in my case, I was on more medications with transplant and less medications on dialysis. But you have to remember, dialysis is a treatment option, and that's like a medicine, I guess you could say, because you are getting treated. Also with transplant, it's also a treatment option that you're going to be taking more medication, but you're going to have a better quality of life. Another topic I want to talk about is energy level. So my energy level on dialysis was very rough. I had low energy all the time. I was constantly tired and sleepy. I was down, not only physically but also spiritually, because it was hard for me for many reasons, and maybe I could do a video about that separately. Also, the possibility with dialysis is depression. I personally don't believe I went through depression phase, but I was just going through a very exhausted and tired phase in my life. Like, I was tired physically but never emotionally, if that makes sense, because I always had the support there that I needed. Now let's talk about the energy level that I had with transplant. With transplant, my energy level was pretty good, like, and it has been since. Like, a lot of you guys had asked me questions about coping after transplant, your mental state after transplant, and so forth. I know everybody's different, but in my case, I felt a lot better with the transplant, because I felt like since my body was stronger physically, spiritually, I felt like I could get stronger again, because I had the energy to want to pray more and to want to read and meditate more because of my health. You know, my creatinine wasn't sky high, so I had that clean blood that pushed me, that helped me. Okay, so that concludes the end of this video. I hope you guys found it helpful. Also, if you guys have any questions, please don't forget to leave them down in the comments below. I read everybody's comments and I try to respond to as many as I can.